I left in 2010.
We shot 4 of them in the car. One of the guys up there went like 7,000 hours. He said, he said like 2,000, he won 7,000. So he said, no, I'm another guy. He's gonna get up to 6.
Yeah.
I'm
Texas,
he wouldn't be able to take it. He was on way to New Mexico. It's not gonna be yeah. So he may give it a shot. He wants to graduate
California at that time. Colorado. Underpaid tax. Great. No, there's so many expensive homes over there coming over here and buying them cheap. That's all. But our real estate has increased about 18% in like 6 months. Is that well, it's really our local economy because like actually, the average income so they can't come to get house. There's so many people that keep people hard to get all of it. Okay?
Oh, really? David,
So we've got Giovanni, Andy Sharon,
oh, gotcha.
Sharon,
He used to be the director of programs.
twice.
He's not the director. Great.
About one is Sharon, and then,
You know, for me now, that's what now I do like the and so we're trying to reach out, get it to included rabbis and priests.
Okay.
So yeah, years ago, and so I'm trying to get that.
So I can take a picture of it. I'm not finished yet because people are still coming out.
You know, yeah, we still have to previously educate, we've done all of this, so definitely, you know, especially since we have history. That would be great. I can have the books. You know, you don't need some writers, you know, to align yourself with the philosophy. Yeah. Thanks so much.
Recently, just recently, last, like, about 3 weeks ago, everybody, really likes it, you know. You should have pushed it in. Put it out. How many years? But we're just saying this. For one girl, we're gonna have to work on it. Yes. My hand is just watching, okay? Should I take this?
Mr. Silva, so that people who are online hear what the questions are. Someone asks, what color is the sky today?
Say that again?
Somebody from the room asked the question. Can you please repeat it?
Oh, okay. Okay, gotcha.
So people
Yeah,
online can
absolutely.
hear the question.
Gonna start the meeting now. Welcome. To the greatest science club in the world. Welcome to everyone who is virtual, online. Thank you for coming. It's good to see everybody. Wow. Yeah. We're going to start with the invocation. If you'd like to stand, please. Lion Victor is going to give our invocation today.
In English, Vic. In English. Oh, we still long.
Sorry.
2 pages, 6 pages.
How are you?
Good morning, Lions. Morning. Now, Lion Boss, distinguished guests, First District Governor John and Arlie. Gonna start a little prayer this morning with, we gotta thank God. God help us to remember as we Lions walk along in life's path, that whatever we might say, let it be only the truth. Whatever steps we take in life, let them build goodwill and better friendships and understandings. Whatever goals we strive to accomplish, let them be beneficial to all concerned. We'll also ask of you to never, ever let us forget the reason we are Lions. We are here to serve all mankind. We ask you to help us to never lose sight of our many blessings, including the food that we are partaking today. For this we pray again.
Amen.
Beautiful, beautiful. Thank you, Lion Victor. Lion Lamont, who leads the pledge, would like to come forward, please? So people at home can see you.
Okay.
The flag is ready.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Very good.
Amen.
Do you want to sing, Mike? Do you want to sing? We're going to sing when David Narzua comes. David's gonna be here next week. So please be seated. I want to recognize our guest here. I'm so excited to have Lion Claude from 5 Points Lions Club here. Yeah. I invited here because we borrowed his spot machine, the 5 Point spot machine. I have it here to return to him. And so I thought, thank you very much for allowing us to borrow that. We also borrowed his table cover and we gave it back to him. So thank you so much to 5 Points Lions Club. I want to announce, okay, our guests, and we want to recognize here today. I see Lion PDG Jim. Would you like to introduce your guest?
Hello, Susan.
Lion boss and fellow Lions, my girlfriend of 58 years, Julie.
Yay!
Hey.
And many more. And we have PDG John Ferry. Would you like to introduce your guest?
Lion boss, fellow Lions, distinguished guests. My guest today is my lovely wife Gina, only 47 years.
Many more. And our speaker will be introduced.
What happened?
Did I miss anybody? Is everybody, all of our, remember, everybody else is a member. Very good. For our health and welfare, one person I know that has dental surgery today is Annette, so keep her in our prayers. Not here today. Anybody else we need to pray for? All right, thank you very much. And so announcements, does anybody have an announcement?
Thank you for the lighting, turning down the thing so pictures come out.
Very welcome.
I mean, a question, any progress on having a meeting at the
It is not set up. It's
Jack and Bill?
at Monte Vista, it is not set up yet. It's not set up yet. We're working on it. A lot of details to take care of, and we have plenty of lead time to inform everybody. All right, I do have a few announcements. September 8th at Escalante Park is the groundbreaking for the all accessible playground. You know, our club donated to that playground. I sent an email out about it yesterday, I believe. And so just be aware that September 8th at 10 a.m. I'd like to have as many lines there as possible to see the groundbreaking for the all accessible playground. I wanted to let you know that Candy Showman's friend, Carl Kendall, he donated a bunch of school supplies that we're going to add to our socks that we're going to give to the candlelighter kids in their backpacks. And so I had it all in the back of my car. All the socks that are all divided up. Thank you to Connie and Delaris and me and who else came? Candy, Sandy came to my house. We divided up all the socks, got them in bags, and now we have school supplies to add to that. I'm gonna take them to candlelighters right after the meeting. If anybody wants to take them for me, that would be very nice. They're over at Loretto Academy. And they're going to add them to the backpacks. We were going to initially going to have a drive-through where we could be there and help distribute all of the school supplies and the socks, but now they said they're going to do a parent pickup all during the week, all day long, Monday through Friday. They're going to allow the parents to pick it up. So we're not going to go and sit there Monday through Friday all day long. So we're just going to drop them off and they're going to give them out for us. So I'm very happy that and thankful to Carl for donating the school supplies, and thank you for our club for donating all the socks to the kids with cancer. And I wanted to thank Rick Schoen again for making all the stickers to put on the animal crackers, Mike Badkin for donating 99% of all the animal crackers, the 500 bags of snack packs of crackers. They're still in my house. We're still waiting for the lion from the zoo to get well. His left paw, he's on an antibiotics. He heard it, and so he's on antibiotics.
His health is on a pause.
There's a story about a lion with a sore paw, isn't there? Oh, this week we had our vision screening at North Loop Elementary. We screened 369 kids one day. We screened 125 kids the other day, and we didn't even get finished. hard. And I wanted to thank Lion Brian, Lion Annette, Lion John, PG John, and Lion Cynthia from Upper Valley. We worked all day long on Tuesday and we worked half the day on Wednesday. And we got most of the kids. We did not get all of them, we got most of them. So the nurse there was very, very happy that we helped screen all these kids. Now she has to notify all the parents of all the referrals, and there was a lot of referrals. Yes, sir.
Boss, I think it's important to note that a very large majority of those children needed referrals. In my time. Much more so than what we saw in Kenny.
There was a lot of kids who needed to go see the doctor.
At least 20%.
So we had a great zone meeting this week. We met at Denny's on the east side, and Lion Mark, past President Mark, led our zone meetings. We had a very productive meeting. Our speaker next week is George De La Torre from the electric company. So if you want to come and complain about your electric bill, come on back. Have your electric bill questions ready. Okay, bring your bill. Awards. Okay, I have a couple of awards I'd like to give. Lion Carlos, please come forward.
What do you do? What do you do?
Is this from last year?
What do you do? Most meetings missed. No.
Congratulations on completing 40 years as a Lion. Commemorate and recognize your years of service. I am presenting you with an enclosed milestone chevron award. You attach this chevron, it has 4 stripes on it. The number of stripes indicate 10 years each stripe. So there,
Thank you.
put that on your pen,
I will.
and appreciate all these many years of service.
Thank you. Thank you.
What kind of award did you take?
And now may I have Lion Bob Lindsay, please come forward. I have an award for you.
years?
We're so happy to have Bob still active and joining us here today. Congratulations on completing 45 years as a Lion. This is a.
Well, I'll get another 5 because I'm gonna make 100.
She's our most senior member, and we're so happy to have him. We're a great example to all of us.
Yes, thank you.
Thank you for being here.
Thank you. Also, I want to let you know that I talked to Deborah. She said she would consider that as a meeting place.
Yeah, very good.
So
Lion Bob was a good
matter of
Samaritan,
working with.
and when he heard we were going to go and investigate Monte Vista, he also asked Good Samaritan if we could eat there. So another place for us to investigate. And so, no further ado, I'd like to ask Lion Brian to come up and introduce our speaker.
Yeah.
Okay, so we are going to welcome Mr. Pifas Silva. He's the Director of Programs and Services for the Alzheimer's Association West Texas chapter, and is charged with providing leadership and strategic direction for the implementation, growth, and quality of Alzheimer's Association programs and services throughout 80 countries or 80 counties of West Texas. Prior to this, he served as a constituent representative for Congresswoman Veronica Escobar and has previously held marketing and community outreach positions within the El Paso Catholic Schools, Destination El Paso, and the San Elizario Independent School District. He has also worked as a journalist with KVIA-TV ABC 7 and the El Paso Times. Pifas is currently a member of the UTEP Alumni Association and the Public Relations Association of the Southwest, and also serves on the advisory council of the Undergraduate Research and Geriatric Experiences program at UTEP. And he is a proud native of El Paso who enjoys traveling and biographical movies and books. So help me welcome Mr. Pifas Silva.
for that, Carter. I'm gonna go ahead and leave my mask on unless you all are having an issue with it. I traveled this weekend to Rhode Island for my godson's wedding. So I was at various airports and on several planes, so just for your safety in mind, I'll leave my mask on. Thank you all for having me here today. It is a pleasure. Next meeting, please let George Silva know that I was the best speaker you have had this month. El Paso being El Paso, George and I are somehow related. My sister-in-law is his aunt, so there's a little confusion there. That's why I kind of chuckled when you said he was following me next week. So give George a hard time, would you please? And as mentioned, I am the director of programs for the Alzheimer's Association West Texas chapter, and I've only been with the association for about 8 months now. I started on January 3rd, and it was an interesting interview process and onboarding because it was all done virtually. All my interviews were done online through Zoom. When I got hired, then my onboarding was all done online as well. And for the first 7 months of my career with the Alzheimer's Association, everything was being done virtually. So I'm proud to say that actually this is the first presentation I have ever done in person. We went back to the office on August 3rd, and so we have not opened the office to the public. Our services are still all mostly being done virtually, our support groups, our education programs, our presentations. But seeing how we were all so close to each other and the invitation that I got from Mr. Carter, I was glad to accept because I knew it'd be a small group. And but it is the first one that I have done for the association in person. So you can mark that as historic there. So if we could pull up the PowerPoint presentation. So we can move on to the next slide.
Give me just a second.
Yeah, you're fine.
I'm slow.
As am I. You'll see that.
Okay,
Okay, if we can go to the next slide.
yeah, I'll get to it.
There we go. All right, we usually begin all our presentations with a mission moment. So I'd actually like to share something personal with you all. The mission moment, like I mentioned, I've been with the Alzheimer's Association for 8 months, but my history with the Alzheimer's Association goes back over a decade. My own mother was diagnosed with Alzheimer's in the spring of 2010. So at that time, the family had to make a very tough decision on what we were going to do. We are a family of 8 children. So we decided that we'd take care of her in her home. And so at that time, I was working for the city of El Paso. I was the spokesman for the Tourism Bureau. So I just decided to quit my job in my social life and move in back to the house where I was raised and take care of mother 24 hours a day, 7 days a week. So I did that job for about 4 years because unfortunately my mother did pass away of Alzheimer's on November 28th of 2014. I'll get to the span of someone having Alzheimer's later on, but I did spend that entire time back in her house, making sure she was comfortable and enjoying the last 4 years of her life. So working for the Alzheimer's Association is not just my job, it's a personal mission, because I got to see firsthand what the association does, how it helps individuals with Alzheimer's, caregivers, and works with health professionals and individuals that take care of individuals with Alzheimer's. So it is pretty much a personal mission for me. So it's a job that I enjoy doing. And I look forward to a long tenure with the association because I see the need that we have in our community, in our state, and in our chapter for that matter. So the next slide, please.
Oh, yeah, on that one. Okay. I'm sorry.
Okay, so one of the main questions is, what is Alzheimer's? Well, as you all may already know, Alzheimer's is the formation of plaques and tangles, which cause the nerve cells to die. And that leads to shrinkage of the brain. And those brain changes result in changes in memory, thinking, and behavior. So looking at these brains right here, the brain on your left is a normal brain, and the brain on the right is one that has Alzheimer's disease. And as you can see, that has the dark circles within it, which means the brain has been shrinking. Even in the size, you see, those aren't changed in size for, they're actually comparative to each other. So you can see that one is smaller than the other. So those plaques and tangles actually then start affecting a person's ability to remember, to think, to plan, and ultimately to function. And Alzheimer's, of course, is a fatal disease. Next slide. We don't know what causes these plaques and tangles in an individual, but what we do know is that there are different groups that are affected more than others. 2/3 of people with Alzheimer's are women, and 1.5 times, Hispanics are 1.5 times more likely to get the disease than their white counterparts, and African Americans are twice as likely. So these are groups that we really try to focus on, just because the history of the disease has shown us that these are the groups most affected by that. But the thing about Alzheimer's is it is a brain disease. So anyone with a brain can be affected by Alzheimer's, and that is pretty much everyone in this room. Next slide. So here, this is a lot of data, and I'll just highlight some of the important ones. 1 in 3 seniors actually die from Alzheimer's or another dementia. And incredibly, it kills more people than breast cancer and prostate cancer combined. It is the 6th leading cause of death in the United States. Yes. And more than 6 million Americans are living with Alzheimer's. As I had mentioned, caregivers, there are over 11 million Americans that are taking care of individuals with Alzheimer's, and that translates to $257 billion of care that the caregivers are providing. I being one of those during those 4 years that I cared for my mom. And also, Alzheimer's is a very costly disease, as you can see, $355 billion in 2021 was what Alzheimer's and the other dementia cost the nation. And by 2015, that is projected to jump up to $1.1 trillion. The other thing about Alzheimer's disease, I said it's the 6th leading cause of death in the US. And in the top 10 diseases, it is the only one that does not have a cure. And in the previous slide, you would have seen our mission is a world without Alzheimer's and other dementias. And that is our goal, to find a cure for Alzheimer's, even though we have other diseases in the top 10 like AIDS and breast cancer and other forms of cancer. It's the only one that does not have currently has a cure. So that's our goal and that's our mission to work on. Next slide. Now, what the Alzheimer's Association work is, we do a 3-pronged approach. First of all, we do care and support, and this is part of the care and support. The Alzheimer's Association works on a national and local level to provide care and support for all of those affected by Alzheimer's and other dementias. So that's not just the referrals that we provide to doctors or the support groups that we do. It's also the education programs that we provide. And this is considered an education program because I'm sharing with you all information about the Alzheimer's Association and how you all can help us get to that goal of finding a cure. We also do research. As the largest nonprofit funder of Alzheimer's research, the association is committed to advancing vital research toward methods of treatment, prevention, and ultimately a cure. And we also do advocacy. We have an advocacy arm of the association called AIM. And the Alzheimer's Association is a leading voice for Alzheimer's disease advocacy, fighting for critical Alzheimer's research and care initiatives and at the state and local level. So we do, whenever we are over this pandemic, we do go to state houses and we do go to Capitol to provide information on how our lawmakers can provide support, laws, and any information that they need to help us pass legislation to help, whether it's an Alzheimer's patient or it's the caregivers. There are several bills that we have been working with on the advocacy side to make sure that our voice is heard, because as you saw by the numbers, we really do need the help and support, not only from our lawmakers, but from the community as well. Next slide. mentioned, we have, I'm in charge of the West Texas chapter. Now, the state is broken up into 6 chapters. And so the West Texas chapter takes the westernmost part of the state. The Alzheimer's, as Mr. Carter mentioned, we cover 80 counties in the westernmost part of the state, providing support, care, and mobilization. We cover from El Paso over to Midland, Odessa, and up to San Angelo, and up through the Panhandle and Lubbock. So that is the area that the West Texas chapter covers. So it's quite a big space there. Can you see the yellow on that? Yeah, faded away. So we provide for that entire westernmost area out here. We do have 3 offices in our West Texas chapter. The main office being here in El Paso, down the street on Mesa Park. And then we have an office in Lubbock and an office in Midland. Up until recently, we had an office in Amarillo, but we did have to close that office down. But we continue working, as I said, virtually. So you can contact anyone in any one of those offices. We have 8 staff members throughout the West Texas County chapter. So it's a difficult task, but that's where the volunteers come in. We really need the support of volunteers. Our volunteers serve as community educators. They serve as facilitators for our support groups. So even though we're just a staff of 8, with our strong volunteer base, we are able to spread the message across those 80 counties that we're responsible for. Next slide. So here in El Paso, I just want to talk about some of the numbers that we have done recently. Even though we were doing everything virtually, locally we provided 102 education programs, which were attended by 2,000 people living with Alzheimer's and/or caregivers. So that sounds like a small number considering the area that we covered. These are just the El Paso numbers, and keep in mind that those 2,000 people were reached all virtually. We were not able to go out to the community and do a huge presentation to a high school or a college or medical students over at UTEP. We had to do everything through Zoom. So keeping those numbers up was a substantial task. I did come in halfway through that because our fiscal year starts July 1st and runs to June 30th. So coming in January, I only came in half the year, but we were able to do our work still, even though it was done virtually. So we're very proud of that. Our numbers, of course, now that we're slowly opening up, hopefully we'll be able to reach a broader audience because some people just feel more comfortable going to a presentation in person. You know, because sometimes in Zooms you kind of lose it. You got Zoom fatigue, you have bad connectivity, there's technical issues. So hopefully when we start opening up again and start doing things in person, our numbers will increase. Because also the exciting thing about that is people tend to take a guest with them. So that even it broadens our ability to spread the message even further. We also still, in the virtual world, held 24 support groups, 69 individuals on 24 support groups. We also took 37 care consultations. Now, care consultations are exactly that, individuals that need information on a one-to-one basis instead of just a broad presentation such as this. We were able to do those 37 care consultations, and we were able to provide 119 calls for referrals. And I'll get to those referrals in a bit on how that works. At the Alzheimer's Association, like I said, we have the staff spread out throughout the 80 counties where we're able to go out and present. But we also do have a wonderful avenue in the Alzheimer's Association because we are a national association. We are able to tap into our partners throughout the state and throughout the nation to provide some information. So if you can go to the next slide, this is what we consider the crown jewel of the Alzheimer's Association, and that's our 24/7 helpline, 800-272-3900. What this is a 24-hour a day, 7 days a week, 365 days a year helpline that is able to answer any and all questions anyone has about the Alzheimer's Association. The great thing about our helpline is that it is being monitored by our colleagues at the association, and they are master degree level clinicians. So any question you have about Alzheimer's Association, they are able to provide you that answer instantaneously on the other line. Also in various languages. Of course, since this is a nationwide helpline, they are able to answer in about 50 languages from what I understand. And they're there. The best part, of course, is 24/7. So you don't have to wait for our office hours here in El Paso from 9 a.m. to 5 p.m. to get an answer to that. If you have this number handy, I would suggest you provide it to anyone that ever brings up Alzheimer's to you. You're able to give them that number and they're able to be helped 24 hours a day, 7 days a week. It is really the best feature of our association, and it really complements the services that we provide here locally or in Midland, Odessa, or in Lubbock. This is just really the best way to get information regarding Alzheimer's. And by get information, I mean anything, whether you have questions about symptoms, whether you have questions about any support groups we have in El Paso, or we have in Lubbock, or even if we have in Los Angeles, California, you can get that information from our 24/7 helpline. They're able to provide a list of senior care facilities that we have in the community, doctors that we work with, lawyers in case you need elder law information, or you need information about anything legally. They're able to provide you all the information just because we are all connected throughout all our chapters. Even though the West Texas chapter, focuses on the westernmost part of Texas, the association is able to connect nationwide in regards to that. And then we also have our website, alc.org. Now that, of course, being the national website, and then you could break that website down and be more local. And that website will be alc.org/West Texas. And that'll provide you all the information that we have in our area for any information that you need, whether it's going on in the West Texas chapter or national. And that is about all the information I have. If you want to go to the next slide, are there any questions that you all have? Anything you'd like to ask in regards to the Alzheimer's Association? Yes, sir.
You said that Alzheimer's Association does do some kind of lobby for the federal level. Why is it that the people who you target, the capital, have not been able to be more proactive with this new medication that just developed, adulterated? The Alzheimer's have only created 3 pills in the last 20 years. There's only 3 pills: Namenda, Aricept, and Exelon. There is 390 for cardiac, and there's 212 for diabetes. So Alzheimer's has always been like in the last priority. The rationale is because they have to die to do studies. But I still think that there's a lot of work to do. Now we have a new medication that only 2 neurologists here in El Paso is using. Dr. Palma is using, and Dr. Boyce. Why is it that we have the resistance in your knowledge now that we have a new treatment?
Yeah. So,
For our people online, can you please repeat the question?
well,
No, just
briefly, the
summarize.
question is the lobbying arm, which goes to our legislature. Why are we not so advanced in medication as other diseases are? And that's a very good question, because just recently we did have a drug that was approved by the FDA, and that's called aducanumab. So there was that drug has been approved by the FDA that's now going to be allowed to be used. Now, what aducanumab does is, once again, there's no cure for Alzheimer's. What aducanumab does, and it is an injection that will be done once a month, it is just to slow the progression of Alzheimer's. So that actually is not a cure-all for the disease. And hopefully with more research, and that's one of, as I mentioned earlier, one of our arms, the 3 branches that we have, that research still needs to be done in regards to what more we can do. And that's where the AIM comes in, the advocacy branch. We need volunteers to sign up for AIM. And that is to contact our local lawmakers and make sure that we get the funding that we need for research, for advocacy in regards to Alzheimer's, and just for the support that we need to keep funding the association, our education programs. I don't know the number off the top of my head, but I know that we do not get the same funding as other states do our size. And so that makes it very difficult. And as a matter of fact, they were going to try and cut the funding for the Alzheimer's Association from what we were getting to even less funding. So we are working on a shoestring budget, and to have that even cut even more would really affect the Alzheimer's Association. So that's why we work to educate individuals to maybe take up that torch and help us talk to legislators to make sure that we do not get our funding cut, that we get bills such as making cities dementia friendly, and that we get them passed, because these are important steps for us to help individuals that are living with Alzheimer's, for their caregivers. So it's all three arms of it: the care and support, the advocacy, and the research they all work hand in hand and are all very equally important. So it's almost a three-way communication that we need to provide to everyone to make sure that we get that funding.
Could you talk a little bit about whether if your parents have Alzheimer's, are you more likely to get it, or more or less percentage-wise?
The question is, of the Alzheimer's disease, is that hereditary? That is one of the factors. It's not the main factor, but it is one of the factors of someone developing the disease later on in their life. My mother lived with Alzheimer's for 4 years, so there's a possibility, me being Hispanic, that I would also get the disease. It is not the main factor. It's not, it's the main factors are your race, your gender, but hereditary, it does fall into that. Not being the main one, but there is a chance, more than likely. So once you start hitting an age of in your 50s and 60s, because 65 is the age where you start seeing people develop Alzheimer's. There is a fraction of the population that does develop disease at an earlier stage, and those are known as early onset Alzheimer's, and that can affect individuals at age 45 and up. But 65 is really the target age where we start seeing people develop the disease and really showing the symptoms of the disease. If you were next, and then I'll come to you.
My question was about the diet. You mentioned that Hispanics and Blacks, the diet may have something to do with it. Also, I'm going through menopause, they give you progesterone, and so medication maybe, because that's something that I'm concerned, because I was doing research on it as well.
Yeah. So the question is diet one of the factors? One of the things that we suggest, and this goes for anyone, really, if you have a healthy diet and stimulate your brain as much as possible. It is shown, studies have shown that people that have a higher education and continuing education, they are less likely to get Alzheimer's disease because they are constantly stimulating their brain. If you start getting older in age and just sit at home and really not being active, then that could cause some risk. It's always best to just continue reading, paint, puzzles, whatever you can do to stimulate your brain. That really makes you a lot healthier and makes the brain healthy. We do have sessions on healthy living, which provide tips on how you can live a healthy life to make sure that you don't fall into that group. But yeah, exactly, diet, especially in a community like El Paso that's predominantly Hispanic, diabetes being a prevalent disease in our area, that all factors into that. So that's why we encourage people to live a healthy life, continue being active. That way the brain, your heart, and your diet really are, helping you stay healthy.
Socialize and join a Lions Club.
Exactly. That's exactly right. I mean, getting out of the house, going out and being somewhere is just really healthy, instead of just, letting life defeat you and say, I've already hit age 65. That's the end. Never do that. Please continue to be healthy.
Doesn't exercise have a lot to do with this also?
Exercise has a lot to do with it, and that's part of that healthy living. there's different prongs to our healthy living approach. We partnered with the El Paso Museum of Art. We partnered with high schools to do kind of painting exercises where caregivers or people living with Alzheimer's can go to these classes and they can paint, because once again, you're stimulating your brain when you're painting or doing an activity such as that. So exercise being another one. I mean, those are the things that we encourage individuals to please do and continue doing even into your golden years, because that's the best. That's the time that you should be most active as well. So yeah, that's a good question.
One observation that I have made in the patient that I take care of is that a lot of times they procrastinate, a lot of times they find justification. Oh, I just forgot it. Well, I'm having a lot of stress. Oh, I didn't sleep well. And sometimes we're seeing patients who have had already the onset for years before they start getting actual care by a specialist.
Yeah.
If you have seen that.
And the other thing is we've started opening up. We started doing our support groups in person. So I've actually started going to our senior care centers. And one of the things we want to do is educate the health professionals that work there, because sometimes they're not understanding what Alzheimer's disease is, and they're not seeing the signs or the symptoms. I myself, when we first started noticing a change in my mom, where she was repetitively asking us the same question, we thought she was just being annoying. But it's really not. That they're losing their memory and they're forgetting just what they did 10 minutes ago. And so some people tend to miss those signs. That's why also being a dementia-friendly city is very important, because if someone is living with Alzheimer's and they're maybe living alone, or their children are away at school or at work while they're at home, they tend to wander off. And so if they come in contact with a law enforcement individual that doesn't know why they're acting in such a weird behavior, it might escalate the situation. So that's why dementia-friendly city laws are very important. And I know there were some this past legislative session to make sure that we train our law enforcement, our police officers, our firemen, our EMTs, to be aware of signs of someone with Alzheimer's, especially when they visit a home with an individual that's 65 or older, to make sure that erratic behavior is not just geared towards being difficult to a law enforcement individual. It's something within their brain that they can't totally control.
I went to get a haircut and I got home and I saw that left my glasses at the barber shop. When I got to the barber shop, they told me that I had it on my shirt.
It starts, that's a very good question, because people always ask that. What are the symptoms of Alzheimer's? And Alzheimer's is not just a forgetting disease, but those are the steps that start being taken, because an individual that starts showing signs of Alzheimer's, they're not aware, they're not able to process around themselves. They're not able to think properly on where did they place their glasses. Why did they walk into this room? Why did they get up from the living room and walk into the kitchen? And when it starts developing to even worse, it starts being things like they put something on the stove to heat up and forget it's there. That's the stuff. And we're all guilty of forgetting where we put our cell phone, forgetting where we put our keys. But if you start seeing that more prevalent in your life, where you're constantly forgetting it, that's an issue where you should maybe visit a neurologist or find some referrals to a doctor to have an examination done.
Can you touch on the conditions that will mimic the signs and symptoms of Alzheimer's, like dementia, like vitamin B12 deficiency?
Yeah, so I've been tossing around the terms dementia and Alzheimer's. Now, those are two different things. Dementia is the umbrella term, and there's different types of dementias. Alzheimer's being the most popular one, I guess, if you will. But there are different types of dementia. So dementia is just the umbrella term. And the easiest way to equate that is there's food, but there's different types of food. There's hamburger, there's pizza, there's Italian. So it breaks down into that. So when dementia could affect the memory and the brain in many different ways. So there's various diseases in there. So Alzheimer's is, of course, where you lose the ability to process thought and memory loss. So as it goes through the brain, it takes through these different stages. So that's what Alzheimer's is. So what makes it most important for individuals to know about Alzheimer's is when you start seeing symptoms of repetitive questions being asked, the same question over and over, when someone is totally forgets, not just forgets how to go from here to Walmart, how they forget to go from here to Walmart. If they're constantly forgetting something as simple as that, then these are the symptoms of Alzheimer's. And that's where an individual needs to be checked. And in regards to my mother's case, that's what she started doing. Not just forgetting, where her keys were, but she was forgetting her own house. She would ask questions as to, why am I here? What is this place? And the place was her own home, which she has lived for in years. So those are the telltale signs. Not just that, oh, I forgot to put my keys in my purse and walk out the door. It's just when they start showing dramatic changes in their personality and the fact that they're literally forgetting where they are or what is going on around them.
My mom used to buy the same stuff at the grocery store over and over.
Yeah.
She thought she was out of corn. When we went to clean out her house, she had thousands of cans of corn.
Yeah.
Because she bought it every time that she had.
Forgetting that she had some at home.
I wanted to
Was
just,
there
go
another
ahead.
question?
No, I just wanted to comment, we've got a lot of people that have been in the club for years and years, and we always try to do everything we can to help. And so, again, if you ever need volunteers for experimentation, research,
All in favor, say aye.
Actually, we laugh, but there actually is something called trial match. And trial match is where individuals sign up and they actually, they become volunteers for experiments, not necessarily experiments like
It's research.
a lobotomy or something, it's research done. So you can actually go on our website, like I mentioned, alc.org, and there is a link there for trial match. And this helps us understand, why are Hispanics being, more prevalent with the disease? Why are African Americans twice as likely? And these are the kind of questions, and we do need, to be quite honest, we do need people in those minority groups to be a part of this research that we do through trial match.
I'm on two of those. I'm on two of those research projects right now.
I'm a past district governor as from the group, and I wanted to let you know, since you're new to the Alzheimer's here, what the Lions clubs have done in the past. When I was governor, your predecessor, she was a woman that was in charge of the El Paso area Alzheimer's group, and she made a presentation at our district governor's meeting because there was a large grant that was going to be given through Congress for this area. And so all the Lions wrote letters to the Congress people from this area to encourage them to support it. Well, one of our representatives, we paid for him to go to Washington, D.C., and that was Lion Dean Royalty from the Five Points Lions Club. And he flew to Washington, D.C. and met with the representatives that were working on this grant proposal in Washington, D.C. And they gave us affirmative action that would be taken. But then we never did hear whether the money was allocated or not.
Gotcha.
We never heard.
Yeah.
But he tried, and he spent a couple of days there in Washington, D.C. But we never did hear whether the grant was given to the El Paso chapter or the West Texas chapter or anything.
Gotcha. Yeah, so the question is, what can the Lions do? Part of our volunteer base is multi-pronged as well. And one being, of course, the advocacy. We do have people that storm the Capitol.
Yeah.
There are, we do have volunteers that have gone to the state capitol and the Capitol in Washington, D.C. to sit with legislators. That's one of the things. The other thing we do have in our office are exactly cards like that are already, filled out. You just sign your name and then send it into your senator. I mean, there's all kinds of things that volunteers can do. And that's what we ask for. We ask for help with that. So I do have my business card up here in case you all would like to reach out. Anything you all can do, you can volunteer as during our walk. Our walk to end Alzheimer's will be held in October 23rd. You can volunteer for that. You can write a letter to Congress to ask, if they would support raising the funding for the Alzheimer's Association. There are all kinds of things, and we already have those processes done. It's just a matter of we've closed down pretty much virtually, but now slowly opening up our office. We'd be glad to provide you all with any information, anything you need that you think would help us, and you could send that out on your behalf as a constituent of our Congresswoman here or our senator, or even our city leaders. City Rep Peter Schwartzbein is very supportive. His family has a history of Alzheimer's, so he has helped us with a great deal of initiatives, and we've also spoken at his virtual town hall.
As you may probably know, Lion Brian's taking the initiative, and we started a El Paso Downtown Lions group for the walk on October 23rd.
Correct.
And so I encourage all of you to come walk with us and sign up, go online. You put it on Facebook just recently, so you can get the link. And we sent an email, I think.
So you can go to the link on the Lions page. I'm not sure, I sent something, posted an event today. It shows all the Lions walking together. Made me feel good. But but you can go on there and you can sign up yourself. You can donate money. You can just sign yourself up and send it to all your friends for them to donate money to you on your behalf, or for you on your behalf to the Alzheimer's Association. Basically, we want to gather up a pile of donations from the El Paso Downtown Lions Club and our friends and families who are willing to donate as well, to support our team who is going to the walk. As many of you that are willing or able to walk with us, I'd love to have you there. If you can't walk, just come to show up and show us your face and your smile and root us on like that as well. It's not going to be a hard walk at all. It's just going to be around the winery. So there will be wine available.
This is at what winery?
Lavina Winery, Anthony. Yeah. So please show up and please, go online, check the Paso Downtown Lions Facebook page. There's a link there, and that's it.
Support the cause.
Support the cause.
All right. Any other questions? Thank you, certificate. Appreciation for you coming out and giving us our presentation. We learned a lot today. It's very informative. Thank you very much. And we also have a bag of goodies, home baked zucchini bread from Miss Betty Crocker Lion Lavon. So enjoy. And thank you a lot for all your time and efforts here.
Thank you. I've got a week of information here, my business cards. There's some bracelets here if you all like help yourselves. And I'll be around for after the meeting if anyone has any questions or wants to talk. Thank you. It's very lovely. Thank you.
We're gonna start our raffle now.
Rolling.
Are you enjoying your roast?
Is this your lucky day? And then a bunch of beautiful gifts.
This is gonna be Carlos's lucky days because he bought $20 worth of tickets.
First one, last three, 192.
Almost.
1 9er 2.
Can somebody help him with the numbers?
Say it in Spanish, maybe.
Oh, no.
He got it. There it goes. I shook him up real good. Just
the whole table. 161.
161.
Third one, 141. 141.
Oh, that's me.
All right, right?
Right here, you got it.
Oh, we did have the first one.
He's got 161, he's got two
He's
so
got-
far.
he's got-
Okay, well, give it to us. Don't be too modest. Yeah, we have to end this at 1 o'clock, so you have to hurry. Come on, Brian.
We'll wait,
Next
we'll let him go
ticket.
first.
1, 2, 3. Oh, no, no, no. All right. All right, Brian.
Anniversary one.
All right. Next ticket. 2, 1, 2, 0, 1.
You got it right here.
Right. Just take one. All right. One. We get the cookies now. Cookies. 182. Wait, Carlos. 182. Okay, we're gonna do that next time. Is that, and you take the cookies as the hand sanitizer? Yes, that's a gift. Okay, the hand sanitizer is a gift.
Here's a 182 right
You
here.
gotta get- All right, this is our new member. We're so happy to have you.
Hey, you got $20.
Again, hand sanitizer. As a nurse, I'm gonna-
Cookies got me in trouble.
147.
That little thing.
147.
I got it.
All right.
There
Hand sanitizer. Everybody squirts. And there's a bag you can put it in. I just didn't want to worry about it.
I got like a.
Yes, yes. There's more little goodies up here, so they'll come back to the meeting and grab them. If there's nothing else for the good of Lionism, we stand adjourned.
Nope.
Good to see everybody. Thank you for coming. Thank you. Enjoyed This is about our walk. Information about our walk.
Thank you.
What is that, a coffee shop?
A spot machine, to check the eyes for the kids. And they could do a job faster.
Audio. This is not talking to you.
See, here's another one. I would like to go on that walk.
Oh, yeah.
These people, I asked him to sit down and special. I told him I would sit down. Well, I could walk if it's not. You know, but it's,
Yeah. I've explained that so many times. It's incredible.
Yes, sir. Yes, sir.
So, shoot me an email with your contact information, and then I'll be able to tell you, where to go to get the information on how you can start. Yeah. There's some cards made out to the senators already. We have those in the office, and so. Yeah. And the person that handles the application for us actually works at the Houston office. And as a matter of fact, when we opened up, I found some of those in my desk, so I sent them the manager on. And so, but I put you in contact with her as well. I should be able to tell you how you could be volunteer to be or. Yeah, absolutely. Email your friends and say, hey, can you forward this email on to this address? That's all you need to do. Absolutely. Thank you. How are you? Nice to meet you.
I want to tell you. Cookies is put enough butter in there. I'm a certified professional card person. I used to be the chief fundraiser at UTEP, under the presidents of UTEP. I raised millions of dollars for UTEP. And then I retired and I started my own private consulting. And I ended up doing multi-million-dollar